at some of the issues, how those dealing with the NDIS have coped with 2020 through the COVID year, and now perhaps coming out of it, and what we're looking at around about 2021. There is a little bit of a crunch coming in this area. NDIS funding reviews come up at the start of the year, and there's some suggestion that because of COVID, perhaps people weren't quite doing what they had been doing, perhaps weren't quite spending the money in the same sort of way that they had before, and so this may have to be taken into account. Hopefully it will be taken into account, or are some people finding that they're already finding that that's going to be something of a problem? If you've got some issues to raise around here, you can join in, and the number to call is 1300 222 702. We're joined by River Knight, who's CEO and founder of Australian Communities. River Knight, good afternoon.
Good afternoon. Thanks for having me.
Not at all. What's Australian Communities?
So Australian Communities, we do a slightly leadership role around Australia, looking at events and ways that we can connect service providers, and also, I guess, help provide some information back to the government around what are some of the things that we're seeing, and provide, a connection point for participants.
Okay. And so you represent who?
So we, as a service provider, we work with people with disabilities around Australia. We also run expos for service providers and participants of NDIS all around Australia. So with 4 million people in Australia living with a disability, we provide some opportunities for that whole population.
Yeah. Dorothy Kaymaker is a Senior Consultant with Disability Health Support Australia. Dorothy, good afternoon.
Good afternoon, James. Hi, Knight.
How you know one another?
River. Hi, River. Yeah. I know of him. Yeah.
What does Disability Health Support Australia do?
We work at the rock face. We work within a slightly bigger arena where we advocate and case manage for people who are having difficulties getting the best out of the healthcare system. And in the middle of the pandemic, or towards the beginning of the pandemic last year, the people who seem to be not getting the best out of the health system and who are falling by the wayside were those within the NDIS. And so we started getting approaches from a lot of NDIS clients who were not able to, because they were finding tremendous barriers in holding up their health care during the pandemic, and the figures are showing that they've done very poorly during that time in terms of accessing healthcare. So we actually advocate for them, or we case manage with them. We work with their care coordinators, their plan managers, and we make sure that their healthcare, what they are getting, keeps them independent and gives them capacity to lead a decent life.
And why was that? I mean, I suppose we can easily imagine that if you're already dealing with a disability and a long kind of pandemic, it's going to be, twice as hard for you as it might be for me. But what in particular were the problems that were happening?
Well, the incidence of health problems is way greater in the disabled community. They have a much higher incidence of chronic disease and of lots of other diseases. They have a lower life expectancy. They have about 8 times more likely to die from cancer, etc. There are lots of diseases where the disabled community does worse. And so in order to stay healthy, they require a higher level of healthcare maintenance, but they were not able to access the services that they required to keep themselves healthy. I had a lady in regional Victoria. I've still got this lady. She's actually still alive, but she looked like she wouldn't live. And her difficulty was that she was having specialist nursing services and community-based services for her diet. She's got a slow bowel problem. And so she had a dietitian who she was relying on. She had a bowel care nurse. She had counselling. And these were all services that were keeping her fit and healthy. And they all ground to a halt because of COVID, and because she lived in regional Victoria, she couldn't replace those services. And since August of last year, she's been in hospital 3 times with an acute bowel obstruction, and once on a ventilator, almost dead. So this pandemic, that's an extreme version, but this pandemic has mucked up the access to people's health services, the supports that they get.
Yeah. River Knight, what were you finding? What were you looking at?
Absolutely, and that's a really unfortunate common story that I'm hearing as well. And what we're finding is I would like to hope that NDIS experiences and looks at that 30% under use of funds in people's plans this year and considers what they can do to provide some support in the sector to get those services back into play, because it is a long road. But I've already sat in NDIS planning meetings where planners have said to participants, you didn't use that funding, so perhaps you don't have evidence that you need that funding. And for example, the case that Dorothy was just talking about there, that would absolutely not be appropriate, and we would not like to be seeing that happening. So we're hoping that the government uses that funding, because it's a $22 billion a year industry. A third of the funding going unused is a lot of dollars that could be used to pump that system back up again.
And so what you're talking about there is that I go to the NDIS and they say, yes, here's your $50,000 a year to spend on your care. I then spend that as I should be and on all the things I need. At the end of the year, if I haven't spent the $50,000, do they often then decide that, okay, well, you only need 45 or you only need 40? And the problem is that this year I may not have spent that simply because things weren't available.
Absolutely. So it's a use it or lose it system. So once that new plan starts, the new budget kicks in, we don't get a rollover of funding. And with COVID, for example, we very much didn't see people not using services because they didn't need them. It's because they physically couldn't. But systemically in NDIS space, connecting with services and getting that funding being utilised well is an ongoing problem, especially regional areas around Australia.
Yeah. Dorothy, Commander, again, I suppose hearing that, I feel as though that seems like a reasonably easy thing for NDIS case reviewers to take on board and something that would be easily understood. We were all affected by the pandemic. Is that not being taken into account?
Well, it hasn't happened yet. It's a fear that a lot of my clients have, that they are going to have somebody in there batting with them, somebody beside them, and specifically it will probably be us for a lot of our clients, to make sure that the underusage of the funding is seen in context. But the reality for all of my NDIS clients is that their needs are escalating. And normally we would be asking for funding for extra services, not looking at dropping funding because services were not, were simply not accessed. But most NDIS clients, all of my NDIS clients, have got multiple comorbidities, and they use the medical system, which is incredibly unfriendly for NDIS clients or for disabled people. They use it at a higher rate than the ordinary person, and they often avoid using it if it's very expensive, if they think it's going to gobble up a lot of their funding. But the bottom line is that if they had that reduced, then it would impact on their health immediately. They don't have a reserve. These people are not healthy people who suddenly need to access the health system. They are very often people with multiple diagnoses and comorbidities, and they crash very quickly.
What did you mean by the medical system is often unfriendly to NDIS patients?
Well, if you go into a large public hospital system, you will find for the 3.8 million Australians who are over 65, so the aged population, you will always find a geriatric ward, geriatric specialists, physios who specialise in geriatric, social workers whose job it is to look after the needs of the aged population. There's an aged care department in Australia that's looking at the health needs and the well-being needs. But if you go into, you'll find a paediatric ward in every hospital, divided up by age groups or by specific needs. Mental health units have always got specialists. But the needs of NDIS clients are specific to the disability group. They are compounded in a different way to the normal community. But you won't, if you go into a normal ward, which is where you will find disabled clients, you won't find that the staff are trained to look after the needs of disability clients. You won't find that the facilities are there to cater to their health needs. The social workers very often are not tapped into NDIS. It's a very specialised area. And in my view, it's the Royal Australian College of Physicians reckons that 1 in 3 people with disabilities needs help, specific help with their health care, because they say that there is a big barrier to appropriate and effective health care for that group. And that's down to largely a lack of focus and understanding of the unique needs of the people with disabilities in hospitals.
Yeah. We're talking to Dorothy Kaymaker, Senior Consultant, Disability Health Support Australia. River Knight, CEO and founder of Australian Communities, about, well, it's this time of the year where a lot of NDIS funding reviews take place. What is it going to mean for those, given that we're in that post-2020 year, post-COVID year? Have their needs may not have changed, but perhaps the expression of those needs changed. What's the effect going to be at this point? River Knight, you were sort of saying that perhaps this money hasn't been spent, so therefore it should in some ways be saved. Government in general seems to be reluctant to either increase money into NDIS.
Well, I guess that the budget is there, so we've already experienced an underspend and a slow rollout with the NDIS. So that funding was allocated to people. So if there's an underspend, which we're looking at the NDIS's own figures now, which are around 30%, when we've got $4 billion a quarter, there is a bucket of funding there that could be allocated. And like Dorothy was saying, it's not just simply about switching services on. So the impact on people with their mental health as well as disability, there's a whole lot of work that service providers are going to need to do to support people to feel comfortable, to re-engage and actually get back out into the community and address also the mental health impact and that impact that it's already had on people because those services were ceased. For about 500,000 potential participants of NDIS.
Mm. In general, what's your review of the NDIS at this point?
My general view of the NDIS? I think they do a fantastic option and they have provided a lot of choice and control for people. But what we find is the systemic challenges. So in rural settings, we have different ways that service providers need to be able to cope and deliver services. And when things like this happen, there's different experiences that they have to be able to manage that impact. And then in the city centres, we have different settings. So it's the systemic issues that almost everyone in the disability sector will see and talk about that are issues, but there's also the historical ones. So we've already had the Royal Commission into Aged Care and of course disability that's brought up a lot of things that a lot of us are already very well informed about, and we need to raise the bar and deliver that sector that we can all be proud of.
Yeah. Dorothy, what's your review of the NDIS?
River is right, spot on there. This is a systemic issue. I work as a patient advocate in the broader community. So I work with my company's Patient Advocates Australia, and we deal with a similar range of issues, health issues, for people in the community when they feel that their healthcare is going wrong. They think, gosh, I need someone to help me with this. So they come and find us. And when I'm dealing with somebody who doesn't have a disability, I find the hospital staff so much better able to collaborate and to get a good outcome for the client than when the client has a disability. And in fact, I'd go so far as to say that I can feel the shutters coming down or a bit of discrimination when it comes to disabled clients. So I think it's a systemic issue in my general population of clients who are unhappy with their healthcare and want somebody to get it back on track. 90% of my 80% of my work is case management. I've got to keep the health system working as it was meant to work, but the health system at the moment is really not coping with the disability sector. And it's a much harder job to achieve the same outcome for a disabled person than it is for an able person, and that ain't easy either.
Yeah.
But nevertheless, that my experience is exactly what River said.
Dorothy and River, let's perhaps pick this conversation up again. Keep talking about it. Thank you so much for joining us today.
You're welcome.
Dorothy Kaymaker, Senior Consultant, Disability Health Support Australia, and River Knight, CEO and founder of Australian Communities.
Return home